women should breastfeed by Brenda Lynn Avery. The Surgeon General and the International Labor Organization both report that American women have less information and less opportunities to breastfeed than in other countries. In 2009, only 15 American states required employers to support breastfeeding women upon their return to work. If you had the power to supply your baby with all its nutrients and devices in order to survive, would you? By breastfeeding, society, the mother, the baby, and in case of emergency, everything is benefited and protected. Now the need. Sudden infant death syndrome, also known as SIDS, is a leading cause of death among infants aged 1 month to a year in 2009. 2,226 infants passed away from SIDS. Childhood obesity has more than tripled in the past 30 years. In California, about 14% of children ages 1 to 17 have been diagnosed with asthma in 2009. And asthma hospitalizations rates generally are higher for younger children ages 0 to 4. Not to mention the cost of formula, medical expenses, and the time new mothers have to spend off work because of sick children. The cost of not breastfeeding is staggering. Just think, a few minutes a day of breastfeeding can reduce the number of sick children, time in hospitals, and money for formula and bottle expenses. This table shows the number of women who are willing to initiate breastfeeding after birth, and then after 6 months, and again at 12 months. The common trend is that it drops. The number of women who breastfeed after 6 months is devastating, especially considering the American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months and continued breastfeeding for at least the first year of a child's life. Yet, according to the Surgeon General of the United States, fewer than 1 in 6 mothers exclusively breastfeed their babies at the end of 6 months. As demonstrated by this chart, in 2004, it's under 10%. It only had risen maybe a little bit in 2008. Those are many of our children not getting the benefits that they need. Now, breast milk fights disease. The cells, hormones, and antibodies in breast milk protect babies from illness. This protection is unique. Formula cannot match because then the chemical process cannot mimic what we have. Formula-fed babies also have a higher risk of neuroticizing enterocolitis, a disease that affects the gastrointestinal tract in preterm infants. Lower respiratory infections, asthma, obesity, type 2 diabetes, all of this, formula-fed babies have higher risks of. Some research even shows that breastfeeding can also reduce the risk of type 1 diabetes, childhood leukemia, and atopic dermatitis. It's a type of skin rash. Breastfeeding is also known to lower the risk of SIDS. Mothers benefit from breastfeeding. We miss less work. Breastfeeding mothers miss fewer days from work because their infants are sick less often. Breastfeeding can be good for the mother's health, too. Breastfeeding is linked to a lower risk of these health problems in women, much like type 2 diabetes, breast cancer, ovarian cancer, and postpartum depression, also known as the baby blues. Breastfeeding can feel great. Physical contact is important to newborns. It can help them feel more secure, warm, and comforted. Mothers can benefit from the closeness as well. Breastfeeding requires a mother to take some quiet, relaxed time to bond. The skin-to-skin contact can boost the mother's oxytocin. Oxytocin is a hormone that helps milk flow and can calm the mother. Breastfeeding benefits society. Breastfeeding also contributes to a more productive workforce, since mothers miss less work to care for sick infants. And employer medical costs are also lower. When an emergency occurs, breastfeeding can save lives. It protects babies from the risk of a contaminated water supply. It helps protect against respiratory illnesses and diarrhea, which can be fatal in populations displaced by disaster. Breast milk is the right temperature for babies and helps to prevent hypothermia when the body temperature drops too low. Breast milk is readily available without needing any other supplies. Think about it. The nation benefits overall when mothers breastfeed. Recent research shows that 90% of families breastfeed exclusively for six months. Nearly 1,000 deaths among infants could be prevented. The United States will also save $13 billion per year. That could put a dent in our debt. Medical care costs are lower for fully breastfed infants than never breastfed infants. Breastfed infants typically need fewer sick care visits, prescriptions, and hospitalizations. One study found that for every 1,000 babies not breastfed, there were 2,033 extra doctor visits, 212 extra hospitalization days, and 609 extra prescriptions for 3 types of illnesses: ear, respiratory, and gastrointestinal infection. Studies show that for infants who received any breast milk for any duration, the likelihood of SIDS was 60% lower. Breastfeeding is the best choice for both baby and mother. Protect your children from the ailments, bacteria, and disease just by holding her close and doing what is maternally natural. Thank you.